These surgeons at Gombe Hospital have their work cut out on this operating table. They're working on their first patient of the day, 17-year-old Ronald Buwembo. Dr. Sharif Shikomeko works at the Habib Medical School of the Islamic University in Uganda, IUIU. He says Ronald has hernia.
It is a protrusion of an organ of the body beyond its natural confines. We have many hernias. We have abdominal hernias, spinal disc hernias, we have hernias in the brain, we can have hernias in the chest, but by far the most common hernias are the abdominal hernias. So they are defects in the anterior abdominal wall.
When under pressure, they are forced through the openings, creating a sac called a hernia.
But also have what called diaphragmatic hernias, where part of the organs in the thoracic cavity herniate into the abdomen through the diaphragm.
It's a condition that can affect anyone. According to the British Hernia Centre, 1 in every 10 people get it in their lifetime. Hernias do affect all age groups, though they are most common in children and the elderly, like this man being wheeled in after Ronald.
Mainly in the children, it is due to a congenital defect in the anterior abdominal wall. For example, these children who have big umbilical cord, big umbilicus, what we call the umbilical hernia. Then in the elderly, as we grow old, our muscles tend to become weak. Sometimes they create openings, making these organs go beyond their natural confines.
There are various types of hernias, but the most common one is the inguinal hernia, which affects about 7 in every 10 people who get hernias. Men are more likely to get this type of hernia. Usually, one may feel a lump, bulge or swelling under the skin, which often disappears when lying down. Some don't swell and are not painful. Whenever one feels pain, it means the condition is at its worst. Hernias are amongst the most neglected type of surgical operations in the country and Africa as a whole. It's so easy for someone to come to the hospital with a hernia and will be chased away. Yet when they go back home, complications can easily arise.
Once the organs are outside their natural confines, they are in a foreign environment, a lot of things can go wrong because they are not where they are supposed to be. The most feared one is intestinal obstruction. And ultimately, the intestines, because of reduced blood supply, they die and then they slough off and then they can cause perforation.
Dr. Mustafa Semugenza, a physician working at IUIU as head of physiology, adds that the state of Uganda's healthcare system has not helped matters. Dr. Sharif says the best chance people with hernia have of getting attention is at free surgical camps. He coordinated the first one this year at Chibuli and Gombe hospitals with support from an international charity called Doctors Worldwide in Turkey.
And you can actually grow with it. I'm sure you'll see people who have had it for ages. You grow with it, sometimes it comes and goes back, comes, and many times you see the worst part, the complicated.
Because someone comes to the hospital, presents with a swelling. It's not an emergency. The doctor says, come back later. So we lose such patients to follow-up.
The British Hernia Centre advises countries to specialize in treating hernias. Ronald Buwembo is recovering after undergoing a successful surgery that removed the inguinal hernia by his groin.
My operation was good because there was no pain. There was cancers there that were responsible for me.
Grace Nancha, his mother, is beside herself with glee. It's however a costly process.
At Kibuli 400 to 500, in Nakasero 2 million, in IHK 3 million. So it depends where you're going to do it. But the problem, the waiting list in the government hospital is so long.
It's mostly natural defects in the anterior abdominal walls that cause the hernias. But is there a way they can be avoided?
Avoid strenuous exercises. For example, if you lift heavy loads, you're going to exert a lot of pressure on your abdominal organs and create what? A defect. Other things that can help us avoid hernias. One, if someone has a chronic cough, when you cough a lot, you exert a lot of pressure on your abdominal organs. So if you have a weakness in the anterior abdominal wall, it can force these organs through the what? Through the defects. So one way to avoid is to identify these chronic coughs and what? Treat them on time.
If medical personnel do not address the problem, many people will continue living discomforting lives as hernias grow bigger, become more painful and inoperable. And for men, it can affect their erectile function. Each day that they are left untreated, hernias get worse because they can't heal on their own. Florence Naluyimba, NTV in Gombe.